this is Dr. Corey Maas on Looking Your Best. I wanted to talk a little bit about fine line treatments of the face. The little wrinkles, radial lines around the mouth and eyes are the most common areas, but some people have them really with sun damage on the entire face. And it starts with a real range of options that are available. The real workhorse for long-lasting results with fine lines is to do some type of resurfacing, which I've described extensively. But there's basically three types of resurfacing, all of which are doing the same thing. They're stimulating the wound healing mechanisms of the body to rebuild collagen and repopulate the skin surface, giving a nice smooth look to the skin and eliminating those fine lines. The three ways of doing that are with a mechanical disruption of the skin surface, dermabrasion or sanding, which is old-fashioned, we don't do that very often. Deep chemical peels, not the type you get in a spa or salon, but a real peel that goes down to the second layer of skin called the dermis and includes part of that. Or laser resurfacing, which we subdivide now into two types of laser resurfacing. The older technique, which is still very popular and effective, which is full laser resurfacing, where the entire surface of the skin is gently removed down to the second layer of skin level. That's the dermal papillary dermis, or the junction of the papillary and reticular dermis, so the deeper layers of the second layer of skin, I guess is a simple way to put that. And when you mechanically take those away or do that chemically or use light or heat energy like you do with laser, the body responds by making new skin cells, reorganizing and remodeling the collagen, making new collagen, which smooths the skin out. And it does that really for the long term. People ask me, how long does laser resurfacing last or fractional laser last? And the answer is really forever. It's remodeling the skin for the long term. It doesn't mean that your skin stops aging. We just turn the clock back on the aging process in the skin, and we really reset it so that we're starting with more youthful skin as a result of stimulating the body's repair mechanisms. There are other options, by the way, for fine lines, which include injectable fillers. And in the old days when we used collagen, starting with what is called bovine or cow-derived collagen, or ultimately moving to human collagen, we really had a great product that we could use, because to effectively treat a fine line, to elevate a fine wrinkle in the lips or anywhere on the face, we have to place the filler intradermally in the skin. It can't be below the skin where we're lifting it all up, or we just have puffier looking skin with lines in it. And that's, I think, a real common error with the basic level injectors, is the understanding of this concept of placement in the dermis to lift that fine line up. Really an important concept if we want to get them, but very effective. And there are a couple of products in particular that we know work quite well with that. That's Restylane Silk, the newer of the Restylane products, and Belotero, which is a product from Maas. So both of those are excellent. We reduce the concentration so the gels are not so thick, and then with a local anesthesia, and they can be injected in what we call a serial point technique to elevate the skin without making it look puffy. And again, I'm not a big fan of what I've seen commonly done with this, what I call the poke and plump technique, where a little incisions are made or a needle is inserted and the entire upper lip is made to look puffy, which ultimately does make the lines better, but really makes the entire lip stick out. Is really should not be the goal in getting optimal results with fine lines. So in summary, we've got fractional laser resurfacing, chemical peels for fine lines. I won't exclude dermabrasion, it's still sometimes used. We do have the fillers that can be used in a very selective way. Restylane Silk and Belotero, in my opinion, are the best options in that. And then there are a few new technologies that are being applied in this area, including ultrasound, like ultherapy for fine lines, which seem to give a benefit, maybe not a long-term benefit, but at least initially a benefit. And some of the what's called non-ablative lasers, which are used to heat the deeper layers of tissue and create new collagen synthesis. Now, what those non-ablative lasers lack is that, as they're just described, with non-ablative means there's no injury to the skin that's visible on the surface. And really with that, you don't get repopulation of the surface skin cells, but we are stimulating the collagen in the deeper layers. There's a lot of attention being paid to this right now. but I would say in general that there's some limitations to non-ablative resurfacing in terms of expected outcomes. Some people get pretty decent results, and others I've seen, pay a lot of money and not really be satisfied with the outcomes. We have a way to go in developing and improving the technology of non-ablative resurfacing. We're getting there, but it's not perfect yet. So that's a summary of the ways that we can treat fine lines. We have the filler option, we have ablative and non-ablative laser options, and then the standard resurfacing, deep chemical peels, would be in that category also. If you have any other questions about techniques for treating fine lines, please don't hesitate to call. You can write us at drmaas.com, or even send in pictures of videos where we can have a online or private discussion about what might be best for you in terms of getting those lines taken care of. This is Dr. Corey Maas on Looking Your Best.